she would send.
Here, take it all off. Take my hazmat suit off.
He's a good man.
Oh, that's great.
A wonderful educator.
What do you say, guys? Let's do this.
Do it.
Kick this off. We are at 11 a.m. Eastern Standard Time. For all of you that are joining us, welcome. My name is Brett Wilson. We have Dr. Mark Hyman joining us and Dr. Sully Sullivan on with us today. I have a long history with Dr. Hyman. I've known Dr. Sully now for a few years and became fast friends and think the world of these two. So appreciative of they taking their time to join us here for the next hour. We're going to get into it. We're going to have some fun. They're some of the most progressive dentists that have been in the industry and are, with Dr. Sully starting his career just a few years ago, and they'll get a chance to talk about a little bit of their background. But two of the most progressive dentists that I know, engaging, dynamic. They're amazing speakers. So I'd love to share more about maybe what they have coming up a little bit later. But let's get started just with an introduction with each of you. Dr. Mark Hyman, if you don't mind just getting us started this morning, and then Dr. Sully can tell us a little bit about himself, and then we'll dive into a little bit of the content.
Love to. Brett, thank you so much for having me, and good morning. Welcome, everybody. It's a joy to be here, part of the DigiDoc family. I'm Mark Hyman from Greensboro, North Carolina. I'm a quadruple Tar Heel because I went to UNC Chapel Hill undergrad dental school, then went to Israel as a volunteer dentist for 4 months, back to Chapel Hill for a 2-year hospital residency, a GPR oral medicine training, and then 32 years in private practice full-time while teaching at the dental school part-time. And now I'm an adjunct full professor and a special assistant to the office of the dean. And I love it. And I love dentistry. I had a glorious private practice career, and now I get the privilege of teaching. I've had the pleasure and privilege of the podium as well, going around. And that's been a real joy for me to speak at major dental meetings and study clubs throughout North America and overseas. And I met Sully Sullivan and did his Millennial Dentist podcast. And if you're like me, to meet Sully is to really not like him, because no one should be this young and handsome. I hate him.
Get out of here.
And just incredibly talented and humble and modest, and a joy to work with. And Brett, what your family business, DigiDoc, the impact that you all had on my career is nothing short of seismic, because I had 8 operatories and I bought 8 DigiDocs, and I bought 4 different versions of the DigiDoc cameras over about a 20-year period. And each one was better than the next. And the impact on my practice, it had a multi-million-dollar impact on my career. So every dental student at UNC Adams School of Dentistry in Chapel Hill is figuring this out, that they're going to have a camera in every operatory and take a picture on every patient before, during, and after. And that, as Sully taught me, it's called mic drop ball game.
Boom. I love it.
Sully, take it away.
I love it. That's a tough act to follow right there. Well, no, again, thank you, Brett, and for having me on. And it's a pleasure, obviously, to get to be with Dr. Mark over there. I mean, you've been a pretty big mentor of mine, whether you know it or not. I got to hear, it's fun. I graduated in 2015, and, being a son of a dentist, I grew up kind of going with dad to like the Hyman dental meeting and stuff like that. So that was actually the first time I ever heard Dr. Mark speak was at Hyman one year, and kind of where he actually planted probably the seed for getting into DigiDoc. And so that's been great. But no, I graduated in 2015, came out, joined my father's practice. 2 years later, bought into that practice, and we've had a lot of really fun success, and we've kind of doubled it and tripled it, and since then, and now we're building a brand new building, and all the while really investing in not only our continued education, but also technology, and trying to be as forward thinking as we can, and trying to make it really easy for patients to say yes to treatment. One of which has been intraoral cameras, and how DigiDoc actually played a role in that. So super excited to be on here this morning, and then also started a little podcast along the way called the Millennial Dentist Podcast. That's been really fun to kind of just share the experiences that we've had, kind of been growing and trial and error over the past couple of years.
I'm not hearing you. I'm not hearing anything.
Uh-oh. We got to get that fixed.
That's right. We can hear you, sir.
Maybe log off and log back in, sir. that may do it.
Sully, what do you like to do outside of dental?
Well, right now it's summer, it's lake season, and I'm in Nashville, Tennessee, so we have lots of lakes, and that's kind of what we do. So, I'm trying to get into golf and stuff like that. I'm not very good. But as a family, we've been a lake family since I grew up. So wakeboarding, water skiing, the whole 9 yards. That's kind of what we do. I actually have, if you follow me on Instagram, you probably see me wake surfing with my 18-month-old. So that's been pretty fun, getting him out in the water, much to his mother's dismay.
So you're still flipping over the wake with your wakeboard? It's pretty impressive.
I'm trying to. I'm not as young as I once was, though. Come Monday morning, it's a lot more sore.
I got shoes older than both of you. I don't want to hear it. You guys are killing me.
This is good. There are a number of you that are on here that we just don't have your name. So there's 3 dots on the upper right-hand side of your screen. If you can click those 3 dots, sounds like, sir, you can hear us now. If you click those 3 dots, you go to rename, you can just type your name in there. That'll help us have more of a personal connection with you. Want to ask any questions? We would love for you to do that as we go along here. Just hit that chat button on the bottom, and you can type in a question, and we will do our best to answer all of them that come through.
Brett, what's really cool is we do have a special guest on. It's a young man who hadn't even started dental school. He's a senior at the University of Florida and applying to dental school, and we're recruiting him to become a Tar Heel. And so Dr. Dariel to-be, he's already said the first thing he's doing is buying a DigiDoc once he gets into dental school. So
I love it.
Have this young man on the call.
Glad you're here. Welcome. Great introductions, guys. Think the world of you. So let's dive right in. We have Baby Boomer, Dr. Mark Hyman. We have millennial dentist, Dr. Sully Sullivan. I fall right in the middle, I feel like, of the two in age. So we're going to go through a number of topics today, and we may veer off of what the list was when we had sent out, but we'll definitely cover that list, and we're going to have some fun with this today. So let's get started. The goal today is to talk about increasing case acceptance. Through generations, how do we communicate with the consumer in the chair? Depending on their age, do we connect with them in a different way? Do we speak with them in a different way? And what really does that even mean? So let's just talk about the dental consumer. How would you guys say we could connect with the dental consumer today? I mean, aren't they all just patients walking through the door?
I think good question, Brett. To me, there is a generational difference, but no matter what the generation is, we are a visual society. And research has said the way that we learn and make buying decisions, it's like 83% you got to see it, and another dozen percent you got to hear it. So it's like 94% of how we learn and how we buy, that you got to see it and you have to hear it. So classically, my generation, you were told, or the way dentists were told to talk to patients was, you need a crown because I said so.
Right.
And that they may have been complicit. They may listen to you, but often our colleagues heard, let me think about it, which is devastating personally. And so that is the beauty of the picture for me, for my generation, that once you show them a picture, my generation, baby boomers, brother Bill Blatchford said they want 3 things to look good, feel good, and last a long time. And when you put a picture in front of them, all of a sudden they have ownership. And that can be really transformational. Sully, how about millennials?
Well, for me, there's kind of 2 sides to it. Because on one hand, being a young dentist coming out of dental school, I think having the ability to show people things is really empowering, because when I first graduated, I wasn't used to trying to convince someone to, pay for a $1,400 crown, or why they needed to replace this missing tooth, and so I was intimidated in trying to either educate my patient on why they needed to do this or what was going on. And very quickly, I found that if I could just show them what was going on, then all of a sudden, to your point, it put the conversation really in their court and saying, well, gosh, I don't like how that looks. What do I need to do to fix it? And then I'm just telling them, I just get to tell them what to do versus having to explain to them. So as a young dentist, it was really, really critical for me to have that visual aid. The other thing I notice, especially with young people, like, specifically millennials, is that we're finding more and more people are educated when they come to the dentist, right? They've Googled their problem. They think they may know exactly what's going on. And so the last thing I want to do is try to get into like an argument with somebody and try to convince them they're wrong. It's like, well, no, I hear you out. That's great. I know that Google told you that, but let me show you what I see. And so to me, it's all about trying to not have to convince them verbally. And I'll just put this, beautiful picture up on the screen and then sit back and be quiet. And so as a young dentist, trying to get people to see what I see, and then connect with a group of educated people by the Google, that's been really helpful for me.
Sully, I'm so proud of you. Who taught you that?
I know, right?
Oh, sorry. People don't like to be sold, but man, they love to buy. And it's been said that their favorite radio station is WIIFM. What's in it for me? So I do love that. And I love the brilliance, Brett, of your product, because it was so liberating for me. I did thousands and thousands of hours of continuing education, and then to sit down with a patient and try to tell them what they needed, and them say, let me think about it. Why did my last dentist tell me about this? You must need a new car. Can we watch it? Can we get a pre-denial from Aetna? It was humiliating.
Well, at the end of the day, like, patients don't want to be told what they need. But what you find is if you ask the patient, like, okay, what do you, patient sits down, well, what do you want, right? Ultimately, they want to be out of pain. They want to have nice teeth. And so really, I then just become the facilitator of what they want. But if I start telling them what they need, then it's this it's like a negative connotation. So being able to present that in a visual form to them, I'm just showing, hey, you want to keep your teeth, here's a problem. And they're like, well, yeah, I don't want that to be there. Well, perfect. Then this is how you fix it. I'm no longer telling you, Brett, you need this crown. It's, you want healthy teeth. You see this problem. To fix it is a crown.
And who really wants to be told what to do, right?
No.
I mean, how many of us really want to be, told what needs to be done? I heard a statistic not long ago, and one of the financing institutions had shared this with me, that there was $12 billion that's out there in patient financing that has been approved. All right, so you present a treatment plan to a patient, it's $5,000 treatment plan, they get approved for financing and they do nothing with it. There's $12 billion out there that has been approved for financing and they've done nothing with it. So that tells me we're telling patients what needs to be done and not really connecting with them emotionally. It may not have everything to do with it, the fact that they maybe didn't see an image, but I know that plays a role. And I was shocked at that dollar figure. And we hear all the time from doctors that say, I don't have any problem with case acceptance. My patients accept what I treatment plan. And I would challenge to go through and really look at that case acceptance.
So Brett, I'll touch on that, because this has been something that, to being in T-Bone's office, I'll kind of give him a little credit that he's been harping on me on, is that it's not that we have a case acceptance problem. It's that we have more of a diagnosis problem, meaning we're not giving our patients the opportunity to say yes to enough because we're not showing them enough. And so ultimately, yeah, you're right. We'll talk to doctors all the time and they'll be like, well, I don't have a case acceptance problem. That's because you're only showing them a minimal amount of things. If you start, and Mark, I'm sure you see this too, when I take these big pictures and I'll use my DigiDoc and take a full arch picture and put that up on the screen, I'll be shocked at how the patient will out-diagnose me half the time, right? Like they're going to say, well, I don't like that, or I didn't even know I had that silver filling, can I replace that? And I'm not saying that all of them should be replaced. I'm just saying it's amazing how if you give the patients the opportunity to see their teeth and then you put their bite up there and they're like, well, I don't like how that tooth looks. And, and the funniest thing is, and we see it every day, you put someone's teeth up on a big monitor from a picture you've just taken, and what's the first thing they're going to say?
That's not my smile.
That's not my smile. I don't like that, etc. Right? Well, then that opens up opportunity for questions. Oh, what do you not like about your smile? And so, but that's the problem. If I only go in there and I'm looking for, cavities and gum disease, and I'm not taking these pictures, and I'm not using, my DigiDoc to do full arch occlusal shots and stuff like that, then yeah, they're only going to say yes to the minimal stuff I'm even showing them. So I think that's something we got to consider too, is part of this is giving the patients the driver's seat to look at their smile and tell us what they like and don't like.
Sully, I love that. Dr. Kathy Jameson said 8 words to me that changed my career 20 some years ago. And she asked me, Mark, how do you create the sense of urgency?
Mm-hmm.
And if that speaks to the people on the call today, for the Patterson family that's here, for the practicing dentists, for teammates, for dental students to be, if those 8 words speak to you and you bring that to your team and say, from this moment on, we're going to ask and create this and sense of urgency with every patient, try to figure out what their hot button is. Why would they say yes? That's a really fun way to work. So most of us are approval addicted and we don't want to confront.
Yes.
And that has been the gift of DigiDoc for me. I started with intraoral cameras in 1991. My first intraoral camera, one camera, was $17,900. So I see there's a few gents on the call that have a few gray hairs like me. Anyone that had a camera back in the day, do you think I felt, Sully, do you think I felt like I overpaid at $17,900? No, it just took me another couple of days to pay for itself. The first time I got my intraoral camera, I'm taking pictures of patients' noses and ears. Finally, I put it between the lips. That afternoon, I checked 4 patients that had been in my practice for 5 years with me saying, you need a crown, you need a filling, you need an implant, you need a partial, and them saying, let me think about it. You must need a new car. Let's watch it. Why did my last dentist tell me about this? I booked 8 crowns that afternoon. Sully, what do you think I did the next day?
Bought
another camera.
I was going to say.
So now we had 8 operatories in my last practice, and we had 8 DigiDocs. And so we weren't punitive about it, but the simple rule was a picture on every patient, every procedure before, during, and after. Hygienists, with my love and respect, if they didn't have at least one photo of one of those big MODFL, TWA, KLMs, you know what I'm talking about?
Mm-hmm.
There was no hygiene check. And I wasn't mean to them. It's just, once you take a picture, I'll come check you. So for the doctors that say, well, Dr. Mark, why don't I buy one camera and just move it room to room? I use the camera all the time. I'm like, no, you don't. You're 20/20 in one room and you're 19/50 in the other room with your communication.
Yeah.
So they're hard decisions in dentistry. Sully, you're teaching with T-Bone Tarun in Raleigh about 3D dentistry, complex cone beam implant dentistry. Those are tough, big number decisions.
Sure.
The number one camera in dentistry today is going to cost you, Brett, what, about $16 a day if you work 200 days a year? 16, 18, 20 bucks a day. That's not a real decision. It's the easiest money you'll ever spend for a multi-million-dollar impact.
Well, and you made a good point. You know, the approval addiction is a real thing, right? I mean, we like our patients, we want them to like us. And so a lot of times we'll be hesitant to really show them or talk to them about what all is going in their mouth. And we'll do that, you know, and we think, well, gosh, they can't afford it, or all insurance is only going to pay for this year. So it's like, okay, I'll tell them about this tooth this year, and then maybe we'll tell them about this tooth next year. And it's like, we don't give the patients the opportunity to even say yes a lot of times. And again, as a young dentist, it's so critical and so imperative, because we are not that confident, you know, unfortunately, about presenting a $3,000, $4,000 treatment plan. I mean, that was terrifying for me. So being able to go around and take a picture and say, here's this tooth, you can see the cracks, you see what's going on, here's this tooth, you can see the same stuff. And then I'm just showing showing them those pictures, you know, and letting them see it from my point of view. They would start saying yes to a lot more treatment versus me having to feel like, oh my gosh, am I going to run this patient off? You know, if I tell them, because we've all thought that, right? Like if I actually truly tell this new patient, they need 4 crowns and 3 fillings, you know, they may go somewhere else. Well, if I just tell them that's what they need, that's very possible it happens. But, you know, to your point, hygienist has taken that out. They're using the DigiDoc to take, you know, close-up photos, wider view photos, so the patient, because that's important to me too. Is one of the things I like about the DigiDoc is I'm not just taking a fixed view of the one tooth. I think the challenge with that is if you just have the one close-up view, the patient lose sight of, you know, we see that because we're so used to living in that world, but they lose perception. And so they'll take a close-up view and then they'll switch, right, you know, one click to another setting, boom, we're zoomed out. Now I get a full arch view or a quadrant view. so the patient can actually see, they get a much better perception of where that tooth is.
We hear a lot from dentists who
Go ahead,
have
Brett.
extraoral cameras, and so they're taking a series of photos on new patients. They go through with face and arch, and so that's one objection that we hear is, oh, well, I have all those photos. We've taken the extraoral photos. My challenge, and we'll see if you agree or if you have comment on this, is where I feel like a big opportunity that we're missing is in hygiene if we're not capturing that full smile photo or that arch image or that quadrant photo during the recall. Is how many times do we really go back and show those patients the photos that we took on the very first day that they came to our practice?
Right.
And are we missing opportunities in hygiene by not showing them that full smile photo on every recall? Because we're all in a different place in our life now from where we were 6 months ago. Right? And I believe many patients are as well. So any comments on that?
My hope for people is just, we don't guilt them. What I'm trying to teach our students to do is start showing a healthy tooth and saying, this is what good solid enamel, congratulations. You have 28 teeth, 26 of them look fantastic. However, I see changes going on in 2 of them. Do I have your permission to tell you about them? And then I'll show them. So Brett, I love you point that out, that there's such a huge opportunity for education, and not to threaten and intimidate and browbeat people, but just to say, it's your body, it's your health. How can I help you? How healthy do you want to get? How soon do you want to get there? It's a joyful discussion instead of a reprimand. And a big piece for me, Sully, I hope you do this, and I bet you do. Do you take the during photos once you take out an old amalgam and take off an old crown? So in your practice, do you file for pre-denials with the insurance company?
Unfortunately, sometimes we do.
No, you don't.
I know. It kills me.
I'm going to come down to Tennessee and smack
this,
you.
Please? I'm trying.
I guarantee you, if you ask one more question, if someone asks, would you file a pre-denial, and you ask the question, I ask you a question, what are you going to do if they don't pay? Because you're showing them that DigiDoc photo of they've got a split body part. I dare you the next week, try that.
I'll do it. No, and to your point, Brett, we're one of those offices that we use DSLR cameras, right? So, it's an important part of our practice. And I think that, it's not that we use one or the other. To me, we actually having this, I was actually having this discussion with my equipment rep, because we're building a new office and and how we wanted to set up, and that because it was important to me that we have a place for where our intraoral cameras are going to be coming from, because to me, it's something we've got to have. And the reason I think that it's imperative where DSLR cameras do drop the ball is, one, there's a convenience of when you need something and you need it now, you need it to be right there and be able to have it. And for my hygienists especially, they fight to do the DSLR full photos as it is. So, and I'm typically only getting them on one time. But things that change, being able to reach back, grab the camera, get the same quality image with the convenience factor is really, really important for us. And then for me, to Mark's point, and while I'm actually working, is every single time that I'm prepping a crown or taking out an old filling, I am mid-treatment picking up that camera and taking a picture. I'm taking a picture of the crack, the undermined enamel, whatever it is, where you could start to see, kind of the pulp horn kind of blanching through, anything that I can, because that way I know that if that patient comes back in 2 months and now they're having sensitivity, I can pull that photo up, show the patient, say, yeah, there was a big crack under that filling. No wonder you're having, some sensitivity. Or if insurance tries to get cute with me, right? And they're like, well, that occlusal amalgam really didn't need to be crowned or something like that. And then I whip out this picture of where this crack goes from marginal ridge to marginal ridge all the way underneath. And those are things that I can't necessarily get with the DSLR camera. I can't get a mirror in there, right? I can't stop treatment, unglove, do all that. It's just not realistic for me to do. So, I don't see how I can not have my DigiDocs, because it's something that is it's daily used in every operatory.
So you mentioned building a new building, and I want to touch on that for those that are in their existing space or they may be looking to expand. Let's talk about the size of monitor. Let's talk about what TV is in the operatory, and from baby boomer to millennial, does it matter? Does it matter the type of TV? I mean, nobody on here selling TVs, right? I mean, this, by the way, is not a pitch whatsoever, but does it matter what size of TV and why?
For me, for my generation, we can't see anymore. We're old.
I'm glad you said it, Dr. Park, because I didn't want to point it out. I was going to say
We had a lot better music
matters.
we got a lot better music than you people do.
That's true.
But I was so proud 15 years ago when we did our new office that we had these gorgeous 19-inch monitors, and they were fine at the time, but that's not what people have at home. It's not what they're working on at work. It's not what they're watching their movies on. They're looking at 50 to 70-inch digital screens. So that's the obvious opportunity to me is, again, it's a false savings to think you're going to move your cameras room to room. It's a false savings to say, well, I can't invest in a big 70-inch monitor. Brett, you go to Costco, how much is a 70-inch monitor now?
Oh, I mean, you can buy a 65-inch.
Is it $5,000 now?
No, $500
with a $25 mount.
I mean, it's not even half a crown. It's a couple cups of Starbucks. It's nothing. So it's an idea whose time has come.
So in our office, we have, and I don't remember who said this, but it's not my original quote. But we have BAMs, big ass monitors. So that is something that's incredibly important to us is, you walk into every single ops, minimum, we're going to have a 42-inch TV monitor in every single operatory. That's a patient viewing. In operatories, and we've been talking a lot about this with obviously the new building, is, okay, how many monitors do we have? We're going to have traditionally a working monitor, right? That doctor, team member, et cetera, is going to have pulled up that we're working off of. But it's really important that we have what really matters on some level of size and quality is our patient monitor. What are they looking at to see and make decisions off of? So in every single operatory, we have this, big 42-inch monitor. In our consult room, we have a 65-inch, monitor that we literally, and I pull that Digidoc up image and the crack's going right through the tooth, and the tooth the size of, it's a 50-inch size tooth. And that kind of tells, I just sit back and be quiet. That tells the story right there. So I think that to me is important. I'll kind of pivot off that too, Brett, and talk about how it can't just be size, it has to be quality. Especially when you're talking to a younger generation. I don't remember life before HD. I mean, that sounds kind of silly, but it's like, I grew up, I'm sure, and I had bunny ear TVs and cable television, but for the reality, I don't really remember standard definition. I was 5, 6, 7, 8 years old. So, for me, I'm used to a level of quality that I expect that. So if I come to your office and let's face it, there are a number of intraoral cameras out there that you can get for $500, $1,000, etc., and you're going to get a $500, $1,000 image. You can take that camera, you can take that image, and then the challenge becomes is as I blow that image up, because I want the patient to have this nice big size image, my quality then with those cameras is even going to decrease even worse. So now here I am in my nice, beautiful office. We're doing really nice dentistry. We're trying to sell a premium product, and I pull up this grainy image that doesn't tell the story at all. Right? It drops the ball. Like that becomes the bar of, okay, what am I looking at? Like, is that a tooth? Where's the crack? Is that a crack or is that a grain in the image? And those are the things that we don't necessarily think about is, oh, well, yes, this can get it done, but if it doesn't convey to the patient like we want it to convey, it's useless.
Sully, that's brilliant. Yeah, I can't tell you how many times in my career so we had 8 operatories of ADEC equipment, 8 Digidocs, 8 Isolites. We had 2 Cerac machines. The number of patients looked at me and said, Dr. Mark, you must be really good. You have all this equipment. I'm like, anybody.
It's perception, right? Yeah.
But it's the packaging of the product. It's
exactly
absolutely
right.
Packaging. I'm going to take a half step back. Imagine you have your SLR camera. You've got your Konica, Minolta, Nikon, whatever you're using, or your Shofu camera, and your patient coughs as you're taking a picture. Post-COVID-19, how are you going to sterilize that camera?
That's an issue, yeah.
Are you going to take that room to room and then it's a vector for cross-contamination? No, you're not going to do it. You want your sleek Digidoc that you can sterilize and keep using. So
well, and along those same lines, I have to say
craziness.
that's an area I run into routinely. Talking about quality of images is my big nice cameras will take very high quality images, but then I'm only as good as how clean my mirror is, or they've retracted. And so part of the beauty of having an incredibly high quality intraoral camera image is that now I can get it back to where I need it to be, and I'm not having to utilize something like a mirror, because if same thing happens, I'll pull up this beautiful image and there's a nice crack going right through the mirror or big smudge on the mirror, and what does the patient point out? They're like, "What's that?" I'm like, "Well, don't worry about that. That's not that's the mirror or whatever." So these are real life daily hurdles that we struggle with if we're only relying on this piece of technology, and we don't have those issues when we use something like the DigiDoc.
I'm going to share the screen real quick and show you just a couple of images. So here are some images of dental practices, and this was one, and I find there's a lot of art, on the wall. So here was art in this particular office, and here's a nice 50-inch screen replacing, the art. And just the impact alone of what that looks like. And here's the dental team with a nice full smile,
love that.
on that monitor, all throughout the practice. This was a dentist in New York. I loved this practice. Not one single bit of technology in this practice whatsoever. He started with big monitors. He's making the move, right? He's getting into digital. That's a 45-year-old ADEC chair. I mean, look at the handpiece tubing, right?
They say that thing's intense. I've never even seen one like that.
It's vintage.
Yeah.
Indeed. Not to mention the pink wall, but the focus is on the monitor in that office. Here was a very nice practice. It was a new office. Just recommended to the doctor, take the art off the wall and put a monitor up and educate your patients based on what you're seeing. You have a beautiful practice. Put this screen in front of them. I don't care where we're going. We can go to Starbucks. We can go to McDonald's. We're ordering off of a 50-inch monitor. It's just the world that we're living in. I mean, look at the difference, right? Same office. Amazing the difference that just a monitor will make. So question to you, as we have a number of dealer reps from multiple companies that are on here, how would you communicate to a dealer rep from the dentist perspective on how bold can they be? What can they say to their dentist to really challenge the mindset of taking that next step, be it a larger monitor, be it an increase in, in technology in the practice? It doesn't even have to be intraoral cameras. It could be any technology. So you speak on 3D all the time.
Yeah.
How would you help dealer reps and how they're communicating with dentists just quickly here?
So I would say that for me, the biggest thing is the majority of tech we buy, the majority of things we buy a lot of times are provided for the doctor to do his job better or worse or whatever, and trying to improve their skill set, et cetera. However, what we don't do most of the time is we don't look at, okay, what can I do to enhance the patient, our ability to communicate with the patient from a diagnosis standpoint? So to me, we spend a lot of time on, okay, I want to learn how to do X procedure, or I want to buy this, want to buy CEREC so I can do in-office milling, or, a 3D printer so I can print guides or whatever it is. But we don't necessarily focus on what's going to enhance the patient's experience. So for me, if I'm, the first piece of technology I would ever buy is something like a DigiDoc, right? My ability to communicate with the patients to get the patients willing to say yes to more treatment. How many offices have you been in where, and the reps can speak to this, where they have all the tech in the world, all the skill set in the world. They've taken everything from Hoist to Pankey to Maxi course, et cetera, but they can't get patients to say yes. And the problem is that they don't have things that communicate with the patient. It is one reason I love 3D, because 3D imaging does that. Same thing with DigiDoc is, again, when I put this in the opportunity in the patient's hands for them to say yes to treatment by showing them teeth or create what they want, then I get more yeses. And so to me, that's why this has to be at the forefront of all the conversations is let's stop educating our patients. I mean, how many dentists do we know that don't get their teeth cleaned twice a year? I mean, we laugh, but like that's a reality, right? How many dentists wait to do fix the old cracked amalgam? How many dentists don't want, X, Y, or Z? And so, and they're the ones that are the most educated in the world. So, ultimately patients and dentists want the same thing. They want a healthy smile. They don't want to hurt, yada, yada, yada. We got to start giving the patients the opportunity to say yes to more of this. And the only way we can do that is letting them see what we see. Putting that picture of their smile up on a 50-inch monitor right in front of them, and then getting out of the way. And so to me, that's the big thing I would say.
Sorry, Sully. Brett, your question is, what can the reps do? I think they can go to every doctor and ask them, what is the number one problem I can help you solve? Don't come in and try to sell me the latest composite, the 19th generation bonding agent. If it's a problem that I don't own, for me, so part of your point here, Brett, of having Sully and I was having two generational opinions. So Eisenhower was president when I was born. The youngest baby boomer is going to, 4 years from now, will be 60, 4 or 5 years from now. So most of your baby boom clients are going to start to think about transitioning their practice if they aren't already there. So how could I bring in a young superstar like Sully to my practice if I have an antiquated office? If he's going to have to come in and change all of the technology.
Yep.
So again, for the reps on the call, look at your baby boom clients and ask them, what are your goals here? What can I help you solve? You're not getting new patients. That's because your office looks like 1492. Let's upfit. Your technology, you're diagnosing using 1980 technology. Let's bring you into the modern world with DigiDocs. You don't have time to get your patients in. Let's talk about doing same-day dentistry. So that would be my perspective from the men and women from the dental supply world. The reps, go to your baby boom clients and say, not here's what I want to sell you, but what problem can I solve? Does that make sense?
I think millennials are the same way. I think part of it is we feel like a lot of times that reps will come in there and try to push their agenda on whatever it is that, hey, I was told I should go out there and push X, Y, or Z product, when, yeah, the first question I'd love for them to ask is, what are your goals, and where are you struggling? How can I help you build your practice? And certain offices, certain things are going to fit really well. The beauty of something like DigiDoc is that narrative is going to fit into most offices. I mean, it really is, because whether let's say, for millennials specifically, typically right now it's grow your practice. We're in a phase of our careers where it's about practice growth. How can I, increase either my patient numbers or do more dentistry on the current patients I have? And so that's where the imaging can be very, very helpful. But your point's really, 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 really important, because I've had reps come in and we'll give you an example of one. They'll come in there and push me doing in-office aligners, printing my own models and doing suck downs to do ortho aligners. I don't have any desire to do that. All they had to do was ask and say, hey, does this interest you? Or what about that? And I can say no and move on, versus, them trying to push their agenda on me, and it doesn't align with my goals as a practice owner in a practice. That's never going to be a good fit.
Brett, you made the point that Care Credit's dental financing has $12 billion sitting there. One thing I would love the reps to consider, it's not specifically your issue, but it is ask your clients that have patient financing, do you have a list of open to buy? Do you know who's in your practice that has been approved for financing and not used it? Wouldn't those be good people to call post COVID-19 and get them in and get an up-to-date DigiDoc photo of these big MODFL, TWA, KLM, and restorations? I mean, you've got people already that have free money sitting there. Why wouldn't you try to bring them in and encourage them? A quick other thought, Sully, relative to what you and Brett both just said. Imagine I'm a baby boom doc that I was planning to sell my practice in the next 12 months. COVID-19 hits, I'm out of business for 3 months. What just happened to the value of my practice?
Boom.
It just tanked, and I'm scared. And so as a rep, if you come in and say, Doc, I got you back, you're going to spend about a couple cups of Starbucks a day to get the #1 rated camera in dentistry that I guarantee is going to grow your practice $100,000, $200,000 in the next 12 months. To me, it's a scientific impossibility if you take a DigiDoc photo of every patient in hygiene that you're not going to add 1 crown a day. let's call it that you're charging $1,000 a crown. Docs work 200 days a year. It's a $200,000 increase in the next 12 months without even trying. So you're going to have my attention as a baby boom doc that's in full panic that I just have blown my retirement. If you can help me solve this problem, if you can come in and say, I got you back, I'll train your team, I'll pick it out, I'll get it installed for you, and you're going to be off to the races. What a gift. You want to build loyalty to your organization. That's an easy way to do it.
I love the breakdown too that you just mentioned, because that's a helpful thing, right? When you can explain to someone, hey, all I'm asking is that if you take this image that DigiDoc produces, you make your hygienist take one photo a day on each patient, you're telling me you can't maybe do one more crown? You know, if you could do one more crown a week, you know, set the bar low. You know what that does from a math standpoint, and you spell that out, it almost becomes like a no-brainer. And to your point, then it's like, okay, well, this is working in your one operatory, you're handcuffing yourself, because that was something we made the decision to do right out of the gate. Was, you know, I heard you talk about that, Dr. Mark, 8 operatories, 8 cameras. You know, we went straight from, we are going to get every single one of our hygienists day one has a camera. You know, and we at the time had another camera, a competitor camera that we weren't having a lot of success with because the software kept messing up. And we went ahead and just said, you know, we're not going to run 2 cameras with the old ones and 2 cameras with the new ones. I mean, we're going to run full gate out of the thing with giving them each the same technology.
And you made a sizable investment to get that done, versus what we hear a lot is, my image is good enough. My image from that $300 camera, that $500 camera is good enough. And gosh, I just want to ask, and do often, good enough for who? You know, who is that image good enough for? I mean, we're not carrying around flip phones in our pocket anymore. I mean, we all have a $1,300 cell phone in our pocket for the most part, right? And Sully, you talked about that a little bit earlier. I want to focus in a little bit more on your treatment planning, some things. And Dr. Mark, you mentioned this, you kind of blew through it, which was okay, but I really want everyone that's listening to be able to have some takeaways of what they can say to patients that really engage them and really help in their case acceptance and verbiage, right? So Dr. Mark, if you can talk about that, and then Dr. Sully, kind of what you say, because I believe what I heard you say earlier is not to over treatment plan the patient, but really understand what they want. Not necessarily what we know they need, but what are they wanting out of this? So if you each could touch on that, that'd be great.
Thanks, Brett. I'd love to. A word that I hope everybody brings back to their practice and every rep brings to their offices is the word appropriate. What's appropriate for the patient at this time in their life. And I love the thought of giving a permission statement. Mm-hmm. Sully, do I have your permission to tell you what I see today?
Yeah, it's huge.
Sully, with your permission, I'm going to do a complete exam. You ever seen your teeth on a monitor? We're going to go tooth to tooth. We're going to celebrate what's healthy. Where we see changes going on, we'll document it. I'd like to study this and then put a game plan together to help you achieve your goals for your health and your teeth and your smile. And sir, if I have your permission to tell you what I see, then you have my permission to do some of it, all of it, or none of it.
Love that.
Brett, is that what you're looking for?
That's it.
It's no guilt, it's no fuss. It's just, do I have your permission to tell you what I see? If they say, I don't want to know,
perfect.
Then say, God bless, see you in 6 months.
Yeah.
Next.
Give the patients what they want. I'm telling you. Now, my question to you, Dr. Mark, is how much are you doing that versus how much have you trained your team to do that? And is that something that you kind of expect them to do? And I think obviously your hygienists are spending, probably an hour with them each day. Talk about that a little bit.
So our new patient experience is I sat down with every new patient, every emergency patient first.
Okay.
Because I'm the cheese, I'm the kahuna, I'm the message.
Yeah, you are.
And I wanted the patient right away to go, whoa, this is different. And I would ask the patient, have you ever had a dentist start a visit like this? And they'd say, I've never had a doctor sit down and talk to me. Now, I'm just a dumb redneck in Greensboro, North Carolina, and our practice ended up top 1% in the country. Brett will tell you, he's seen my work. I'm not that good, but I hired an amazing team and just got out of their way.
Yep.
So everybody was schooled in these verbal skills. Sully, here's a shocker. We practiced, we trained. Everyone in my office went through Dale Carnegie training, how to win friends, influence people.
Mm-hmm.
I'd been through Pankey. I'd been to Spear. I brought all that back to the office. So we paid for excellence. We paid for coaching with Jameson Management, one of the greatest gifts I ever did. I would love it for the Benco, Shine, Patterson, whoever's on today. If you have a young dentist and they're buying equipment, what a gift to encourage them to go to Pankey for a first course. What a gift to have someone from Jameson as part of your package of selling them all this equipment. Let's train you in excellent verbal skills on how to use all this stuff so you keep growing and buying more stuff from us. It's not about a one-time sale. It's about a relationship.
Right. One thing we do too that I think is really important is treatment calibration. So being on the same page with your team, and so one of the first things we did once we got our DigiDocs was we basically did a week where they took a lot of pictures. We took pictures on each other. We took pictures on obviously the patients. And at the end of that week, we set a whole half day, literally took off from lunch till we had lunch and then didn't see patients the rest of the day. And all we did was go picture by picture and put up different cases, different patients. And I would ask the team what they saw. And so the point was I need the team to see like I see, and it can be very eye-opening that, they may notice things you don't, or they may notice things you do. And then, they may see something and then say, hey, what would you do on that tooth? And so that's been really, really helpful for us, is using these pictures to really calibrate as a team, so that, for instance, when I go in to check a patient, they've already set the patient up for the likelihood that I will probably, they've showed them the picture, they've gone over that, they've asked, what do you think we'll need to do? And we're on the same page. So they say, well, he'll most likely, he may do a 3/4 crown there. We use some of our CEREC technology to do an onlay in this situation, so we don't have to cut all your tooth down, or, he may have to crown that one. And so we've done a really good job of using these images to kind of calibrate across the board. And I think that's something that we don't do enough of, on a routine basis with our team.
That's very good. I'm going to share this and just show a couple of images for those that are viewing, so they can get an idea of, like, what are we talking about?
So good.
Like, when we talk about an image, like, really, what does that mean? And is there really, a difference? And so here's one. Of course, that's a macro image, which is very close in the photography world. And you can put that on a 70-inch screen. I think I have one on a 70-inch screen here in a second.
Brett, just give me a handpiece, man.
Yeah, exactly. Here's the difference.
That's called supper time. Look at that thing.
Here's the difference between an HD image and an online image. And so when you don't see it side by side, you may think in your mind that it is good enough. But then the challenge comes in with the consumer today. What are they used to looking at? Now, this particular image, if you two would just treatment plan this based on, Dr. Mark's going to talk to the baby boomer, and Dr. Sully, talk to a millennial sitting in the chair. So you have a 2D colored photo on the left, and then on the right is a lume transillumination photo, which I know you both have used in your practice. So if you could just quickly treatment plan that would be great.
I guarantee you that baby boomers don't want to lose their teeth. And I can speak to that because I lost number 19. I had internal resorption and ended up with an implant and an implant crown. And that was one of the worst days of my life, losing a tooth. So my generation we do not want to lose body parts. So if you looked at me and said, you need a crown because I said so, I'd go, really? If you said, Dr. Mark, how would you feel? Tell me what you see here. I see that line and I describe, looks like my tooth is cracked. How would you feel if we watched it and the tooth split the rest of the way through and you lost that tooth? And I'd say there's no way in the world, I am not losing a tooth. So that is a crystal clear crack. I would describe that as a dramatic change going on in the mouth. And I would give the patient the opportunity to secure that tooth so they get the chance to keep it the rest of their life. Do you guys like that verbal skill?
I love that. Yeah.
Let's secure it. Sully, you mentioned not drill the whole tooth down. That's I'm sure you don't say that, but it's a pretty visceral verbiage. But what's the benefit statement that we get from this picture is, isn't this great that we caught this before it split into the nerve? It's probable you don't need a root canal yet. Does this hurt yet? do you want to secure this before it splits through and through and then you lose the tooth? Is that what you're looking for, Brett?
Absolutely.
Sully, what are your verbals here?
With the beauty here or not the beauty, what I'm finding is specifically with, my kind of age group is that coming out of the coronavirus stuff, people are a lot more aware of their health and wanting to be a little more proactive and conscientious of what's going on. So they're more interested in their oral health than they previously had, which I think is great. Obviously for us, because we're having patients that are a little more motivated to look into this stuff. So with this tooth, I'm definitely doing the same thing. I love how Dr. Mark mentioned the yet. You put this up, and a lot of times I'll go, and just sit back and kind of wait, and they'll be like, what? Perfect. Well, they've just asked me, they just engaged me, they're interested. Now I'm just communicating with them. So I'd say, well, that's a big crack. And they're like, where? And I'll show it. And that's where the loom becomes nice, is I can say, not only is it, you can see this crack on the left photo, but do you see the darkness, underneath that crack, where this is now, what happens is we have enamel that protects our tooth, but inside the tooth, it's pretty weak. The hardness of that is not as strong. And so a lot of times we'll have this kind of iceberg effect where, we see something small, but in reality it's a lot bigger. And so you can kind of see what that looks like through, when we illuminate this, and again, going on to, has it started hurting you yet? That's an incredible, powerful, being able to, the yet verbiage is very, very powerful for kind of giving that sense of urgency to the patient, letting them understand that, hey, this is something that is going to happen, right? And we know that. I mean, ultimately, that continues to go on. It's going to be a problem. We try to never use the word watch in our practice. It is or it isn't. That's either a crack or it's not. That's either decay or it's not. And so I'm going to give the patient the opportunity to say, here's where it is. This is decay. This is a problem. And how we fix it is ultimately up to you. And again, putting that patient in the driver's seat, letting them own their problems, not telling them what they need. You'll never hear us go around and say, 2 MOD, 3 crown, 4 core crown, 5 DL. And with our patients, when we treatment plan, we don't do that. When you walk out of our office, you're not going to get a treatment plan that says, a bunch of tooth numbers, a bunch of dental codes, and a bunch of stuff. We're going to really dive into this, and we're going to write this out in verbiage that the patient understands and appreciates. So it may be something like secure upper right tooth, with all white, crown or something like that, or, replace broken filling with new white filling. We're going to use verbiage like that the patient understands, so that they see. We're not going to put in there D01432 DL, $75. And so we're seeing a lot more yeses, because we're showing patients that, and they're getting to see what's being done.
Love it. Sully, when the Terminex man comes to your house and says, you got some termites, but we caught it early, isn't it a celebration instead of
right, exactly.
my house collapsed? Yeah. So what I love about Loom, Brett, is I would love our whole dental profession to shift our mindset to say, isn't it fantastic we caught this before it got away from us? There's a 90 to 95% chance, because we transilluminated this tooth and diagnosed the termites here, that we can secure it before you need a root canal. How cool is that?
And with that transillumination, what I'm hearing, the feedback from dentists, is they can see what they just can't see from digital x-ray. What we're missing with digital x-ray, we can now see with this. And many dentists have been seeing it a while, for a long time with just the light, but now we're able to show the patient. So this has been great. As we start to wrap up, a couple of things. One, love to know post-COVID, what technology can, in your practice, you just can't live without? Maybe, product or technology, just quickly run through for those. Dr. Mark.
You know my story. The camera leads to everything else. If someone has to buy a whole new HVAC and these funky evacuation systems for their air, and a DigiDoc in every operatory pays for everything. People say to me, Dr. Mark, I want to get into CBCT. I want to get a CERAC. I say, put a DigiDoc in every room, use it every patient, every procedure. In 6 months, you get a free cone beam. You get a
It's
you get a
exactly
free
right.
CERAC.
Yep.
It's not real money for the transformational, colossal benefit and impact that it has. So whether it's a young millennial trying to be credible or a baby boom senior doc trying to regain the value of his practice, the camera leads to everything else.
You like Isolite as well. You're a fan of Isolite. That'd probably be one of the top products that you would.
We only have 8. Isolite every patient, every procedure. It's $2 per mouthpiece. I've had people say to me, Dr. Mark, how do you charge for the $2? And I'm like, dude, that just cut the time it took you to do the procedure 30 to 50%. Why do you care?
Not to mention that they don't have to, they're not talking every 2 seconds and they're not going, can I get that? Can I get that slide injector, please? You know, or that is the worst. No, I'm with them on that. Having that is saying good thing. I'll take a little bit of a different approach. To me, I think I tell everyone it has to start with your ability to communicate with the patient. Diagnose things that help increase your diagnosis cash flow like crazy. So to me, DigiDoc's a no-brainer because it cash flows literally month 1, right? If it helps me do, 2 more crowns that month, it paid for itself. It's literally a cash. It becomes like an ATM. I mean, the more images I take, the more dentistry it spits out. You know, but I'm a big fan of 3D. Cone beam becomes my second thing probably because it's all about you can't treat what you can't see. That's why it starts with pictures. It starts with Loom. It goes into cone beam because ultimately those things cash flow really well. I'm a huge CERAC guy, but the problem with that is it's not necessarily helping me generate more dentistry. It's making me more efficient, and I'm a huge believer in it, and patients love it. But I want to invest in the things that lead to really producing more out of the gate, and that's why imaging to me is the number one most important thing. That starts with the imaging that communicates with patients, right? Which is what DigiDoc is, and then it leads to what helps us find more stuff as well. And then specifically, a company that I'm a big fan of, and really, really been a big fan of coming out of, post coronavirus, is Dental Intel. Being able to know your numbers and really cherry pick different patients or procedures has allowed us to have, May was the 3rd most productive month we've had in our practice's history.
Wow.
And that's because we had a strategy coming out of the coronavirus. We knew the patients we wanted to call first. We knew the patients we wanted to see first because we were going to cherry pick the ones that allowed us to do more profitable procedures, allowed us to do more on them, the ones that, had balances, had money to spend. And so to me, that was being strategic in that coming out of the coronavirus has been really, really helpful.
Fantastic. That is so good. One of the next topics that I would like to cover is teledentistry. I believe there's an opportunity for that to become more efficient. So starting to poll some offices, getting some feedback. So would love to get on another webinar and talk through that. Love to show you all just real quick here. By the way, I didn't have a conversation with Dr. Mark or Dr. Sully prior to this. So really just wanted them to share what was on their heart. So hopefully you all trust in the fact that none of this was staged, and it certainly didn't mean to be a commercial. Just wanted people to speak from what's working in their practice and from their experience. And I believe that's powerful. There are a couple of opportunities that we have on an upgrade on cameras and on our handheld x-ray that we have out there. So you could just reach out to our online, doing a lot of virtual demonstrations. All of our products can be presented to you virtually, trained virtually. Love that everybody's becoming more familiar with and comfortable with Zoom. So that's been a huge advantage for us in having products that complement that. So you can just reach out online if you're interested with that. So as we come up on the top of the hour, I can't thank you both enough. I mean, you're leading by example. You have fantastic practices that you have that you run, and it's unbelievable what you're doing. And Sully, I'd love to hear some of those numbers and be able to share that because numbers don't lie. They really don't, and you've proven that. So thank you so much for your time. Thank you to everyone who has joined in with us today, and look forward to the next one. Appreciate you all very much.
Thanks, everybody. Stay safe and take care.
All right.
That's right.
Go Tar Heels.
Brett, I got to talk to you about those x-ray things. I'm thinking last year we collected just north of $1,000 per patient. So we're doing more on the same amount of people. So in 2015, our active patient base was probably 3,200. Here we are, 2020, our active patient base is only 3,600. 400 more patients, yet we've almost tripled the practice. Because when you do give patients the opportunity to say yes to more dentistry and they see their mouth in a way, they will outdiagnose us.
Wow. Congratulations.
So proud of you, young man.
It's fun.
I'd love to come back on the Millennial Dentist
We got to
podcast.
do it. Let's set it up. And do it.
The last time was fun.
Good stuff.